So the promised 5 easy wins are coming up. And they're not actually specific pieces of information, because I could have done a presentation about what you need to tell people antenatally. But if you're at uni or you're in post and you're going to infant feeding training in your trust, you will already be receiving this, and you can find this information very easily. I think it's actually more important that we look at how it's delivered. So that's what we're going to look at. And this is my one and only slide that contains a shameless plug for the app, but it demonstrates really nicely some counselling skills being done by the AI. So C is for counselling skills. We are going to care. C is for counselling skills. We need to listen to them before we try to inform them. We need to accept their feelings. There's no point if the mother is feeling like she's failing before she started. If you respond by saying, no, that's not true, what you've done is tell her you don't believe what she says. So we always say, oh, poor you, or yes, lots of people say they feel like that. Accept it first, because that's your springboard. And language is such a tricky thing. And we say things, I'm talking live to all of you now. The words are just tumbling out of my mouth. At any moment, I might say something that's twisted a little bit in the way it's come from my brain to out into the world. And we need to be really careful with our language. But we're not robots. We're all humans. So practicing your positive, non-judgmental language and all of your soft skills, and practicing using appropriate and personalized language is good. But I would say, if you hear something tumble out of your mouth that you think, ooh, that wasn't the right way of phrasing it, you just say, what I mean is, and you retreat, you reframe, and you represent it, and maybe say it twice, maybe repeat it later in the good way of saying it, so that you can just, help them to hear it in a better way than you maybe said it the first time. Also really key, checking understanding. That is not to say that you say, do you understand what I mean? Because almost everyone will say, yeah. You actually need to ask them what they've heard from you. Is that making sense for you? Is there anything that you'd like to share back with me? What have you got from that? How has that changed what you're thinking about? Did that add to what you're thinking about? In what way? And so you can move the learning on from there. And if they've slightly misunderstood something, that's the time that you pick it up. The second C is for collaboration with colleagues. So I've put up, that's just a pretty picture from the digital maternity program, all about how we talk to each other. And I've also put up the Badger and You're a King logos. I'm sure other people exist as well, but it's an opportunity to communicate with our colleagues. So yes, we discuss at every opportunity with the expectant parent as an individual, but there's more than just you speaking to this parent. So make sure they've got the same messages coming from lots of different places, and maybe say, oh, so you had, your scan appointment. Did anybody talk to you about infant feeding? Or, oh, you've seen the consultant. Did they speak to you about infant feeding? Or, I wasn't here last time. I see you saw Sally. Did she mention anything about infant feeding? What did you cover? Let's move on from that. And you can record that in your notes. Make sure that the colleagues can see what's been discussed, not just a box that ticks. If you can, actually write something. And if the mother has decided she wants to breastfeed, one key thing that staff members have said to me is, wouldn't it be nice to actually have it written in the notes and in the birth plan that this mother intends to breastfeed, so that when that baby is born, if there's any obstacles, any bumps in the road, the staff involved know this mother intends to breastfeed. We better make sure we facilitate that. That's something we need to keep in mind, because it isn't the thing you're thinking about when you're delivering a baby. Mostly you're thinking about the safety and the mother and the baby. I get that. I have, the luxury of not being a midwife. I think you're all amazing, potentially slightly unhinged. However, it's because you're doing such a hard job, such a responsible job, and absolutely, as Sue said, not enough of you, and very, very stressed. But we can support the parent at every stage of contact if we all work together on it. And further than that, it's not just individual members of staff. It's about our educational strategies. It's about changes in policy and practice. And it's about the whole of the healthcare system, not just one midwife, one clinic, one infant feeding lead trying to do everything. It needs to be completely systemic. It needs to be from your director or your head of midwifery, from the board level of the trust down. It needs to be filtered through everything. It needs to be the whole LMNS, the local maternity and neonatal system. Everybody all saying the same things and getting the right education, the policies and procedures in. So A is for assume everyone will surprise you. Because it's easier, we tend to pigeonhole people and we make assumptions. And there's that saying, isn't there? Assume makes an ass out of you and me. Assume at your peril. People will surprise you. You might meet, and I spoke to a family nurse practitioner this week, and they work with the teenage cohort historically. It's changing slightly now. And she was saying that actually she's seeing the breastfeeding rates amongst the young mothers actually going up. And she's found it surprising that she didn't even really know very much about breastfeeding to tell them necessarily. And it hadn't been part of her kind of regular patter because it wasn't taken well. But now more of them are breastfeeding. So that's lovely. Don't know if that's necessarily happening in the over 30s as well. But anyway, but they might not know what you expect to know. Again, we need to ask, and we need to listen. They might know absolutely loads and already have read 17 books and gone on a course and have 3 friends who have come round and given them loads of information. They might have really fixed intentions. I am definitely going to breastfeed, or I am definitely not going to breastfeed, but they equally might never have thought about it ever. And they may not have the plans that you would plan for them, but they are their plans. And what we need to do is make sure that these are informed choices they are making. There's nothing more traumatic and grief striking than finding out later that you made decisions based on something that wasn't true, or you didn't have all the information. So people get angry later and defensive and grief stricken later. R is for referring on to others. This is not all on you. Frontline member of staff takes on a huge responsibility, but actually, if there are reputable and reliable sources for you to signpost to, if there is a peer support group, if there is an infant feeding team, if there are antenatal courses, I'm going to say, if you're using Anya in your local area, signpost to the app, get them in when they're pregnant, get them to the breastfeeding groups when they're pregnant, get them going to these antenatal classes, signpost them to good websites and good Facebook groups locally. It might be that there's a brilliant local Facebook group. If you don't know the answer, it is always better to say, that's a really good question. I don't know. I'm going to ask so-and-so and I'll come back to you, or I'm going to get so-and-so to get in touch. And that's how it works in my trust. We don't have a specialist infant feeding team with an email and a clinic and all of that. Our setup is really ad hoc. Literally today, I've spoken to 2 health visitors, a midwife and somebody from the paediatric ward who just got in touch and just wanted to ask a question about something, or they put somebody in touch with me to contact. And that's how it works. It's all very, they know that when they don't know, it's better to pass it on. And it shares the burden, and it's not you then having to hold all the essential information. You're signposting them to reliable sources. And that doesn't mean giving them a discharge email from the hospital that's got 75 different links to click to open things, because they're not going to open them. Even in the days when we used to have leaflets and bits of photocopied stuff, I might have flicked through it. But if it's a photocopy of a photocopy and it looks like you're not very valuable, you feel not very valuable. It feels not important. We loved, didn't we? Have I got one on my desk? We loved the old off to the best start leaflet, and it's got pages and pages and it's shiny. That was great, but we don't have that anymore. So we have to find electronic things to give them that actually will make them feel good. And that's because they need to feel empowered. E is for empowered. They need to believe it's realistic. They need self-efficacy. They need to feel like this is something they can do. And they need a connection to the appropriate support so that they can facilitate those wishes. So I'm not going to read all of this out. I do invite you to go and have a look. This is from, actually, these are my PhD supervisors, and I know they work really well, Jill Thompson and Nicola Crossland. But this is about them evaluating a peer support scheme local to me. But they looked at the empowerment, the way that they felt empowered. So, you know, it positively influenced their beliefs toward breastfeeding. I learned so much about it. And prior to this, I was unconvinced whether I would bottle or breastfeed, but I had no doubts after that support. So that's what you need. Somebody who's going to make you feel like it's within your grasp. I've stuffed this in at the end because it exists and we should be using it. So the Good Practice Guide for Midwives, this is all the information that needs to be dealt with in pregnancy, but look at how it suggests you do it. What I'm saying is not new. This is from 2012. Find out how parents imagine the baby. Take time to listen. Ask the partner to sing to the baby. You know, point out that the ultrasound shows the baby actually reacting, and so on. This is how we build relationship with the baby, so that they are going to make better informed choices, because it's a real person. So, brief recap. Number one, this is a public health imperative. We absolutely need to be doing it. I don't take away from the fact that it is difficult, because we've got marketing influences, we've got cultural influences, but our socioeconomic factors of some of our families that we work with make it even more important for them. And with the cost of formula being what it is, and the cost of electric being what it is, and everything else going through the roof, it's even more important. And it doesn't just come down to you, it is everyone's responsibility. So then our recap of our care is, I've put these in the wrong order just to confuse everybody. Counselling is essential. Collaborate with your colleagues. Assume everyone's going to surprise you. Refer on and be honest. And empower those expectant parents so that they've got the information they need to make the good informed choices. So I'm here on behalf of Anya. Anya does have a 1,000 days scope from conception to the child's second birthday. And the intent is that the parents could then have evidence-based information, and this helps staff who are frontline with those families to collaborate with it and get those public health messages across from all directions, and in a way that feels non-judgmental and safe, and so on. You can contact us. You can email hello@Latchade. You can look on our website, which is Anya Health, and you can find us on the socials on Anya Latchade. And here are my references, which I know you've provided separately. And that's me done.